Okay, so I want to welcome Dr. Tamara Hunter to discuss with us fertility after a miscarriage. So I'd love you to just tell us a little bit about yourself, Tamara.
Yeah, so I'm an obstetrician and gynaecologist, and I have subspecialised after doing that training in the area of reproductive endocrinology and infertility. I also come from a background as an exercise scientist before I studied medicine, and so I guess my perspective on women's health is very much about the holistic health of a woman, and particularly related to pregnancy and fertility.
So you are the perfect person for us to discuss this with. So when we did a lot of focus groups with women who had miscarriages, they had lots of questions about trying again, and they felt that they just needed that little bit more information, because when they did speak to their doctors, they were generally in a heightened state, so they couldn't register what they needed to about trying again, and it was one of the biggest questions that they had. So I suppose one of the questions that they asked was what specific steps can be taken to prepare their body for pregnancy after a miscarriage loss?
Yeah, so the one thing that often happens after a pregnancy loss is that the pregnancy hormone has to come down to zero. So you might know of the beta HCG is the pregnancy hormone, and it depends at what stage in the pregnancy you lose that pregnancy as to how high that hormone is. The higher it is means the longer time that it needs to come down to zero. And so often the period that happens after the pregnancy loss is a lot more delayed. So if you normally have a 4-week menstrual cycle from day one of one period to day one of the next, often this next cycle will be much delayed, maybe 6, even 8 weeks. And so that can be a little disconcerting for women if their period is not coming back in the time that they expect that it should, but that's because that pregnancy hormone comes down. So for that reason, I will often say to a woman, it's a good idea for you to have a normal cycle before trying to conceive again. So what I mean by that is you have the pregnancy loss, the bleeding stops, there'll be some delay before the next period comes, and then have one more cycle after that before you start trying to conceive, so that you know that your body has gotten back to its normal regular menstrual cycle before you start trying to conceive again. I find that if women do that, they're a lot more comfortable with being able to figure out what their last menstrual period was, so that they can then date their next pregnancy, how far along they actually are. So it seems somewhat of a practical piece of advice. There's not a lot of evidence to say you shouldn't fall pregnant straight after having a pregnancy loss, but I certainly do think that it helps from a menstrual certainty point of view.
I think practical is what they want, though, which is at this stage you just want to know, or you want someone to lead you.
And the other thing that I think is really important in sort of preparing to fall pregnant again is sometimes the bleeding with a miscarriage can be quite heavy. In fact, most of the time it's quite heavy. And so there can be some iron deficiency that results from that. So I think it's really important to optimise diet, particularly iron-containing foods, so some sort of lean red meats. I believe that anyone preparing for pregnancy should really embrace a Mediterranean-style diet, so high in fruits and vegetables, lean meats, dairy, nuts, seeds, grains, and oils. So I think optimising, I guess, the temple for pregnancy, and making sure that you are consistently taking your multivitamin or pregnancy multivitamin that contains folic acid. That's really important as well. So I think if you just get those basics in place, it would be reasonable to start again.
Okay, that's really fantastic advice. How do hormones change after a miscarriage, and how does that affect your fertility and emotional health? So I know even just me, and we were just talking about, we've got daughters who are going through the teenage years. Their hormones and my hormones going through menopause are up and down. And how is it after a miscarriage?
Yeah. So your estrogen and your progesterone are quite, or particularly your progesterone is quite high in pregnancy. And then you've got the pregnancy hormone itself, beta-HCG. So those hormones are quite high. Another hormone that is quite elevated in pregnancy is also relaxin, which makes your joints quite relaxed and quite mobile. So all of these hormones come back to baseline from being pregnant to not being pregnant. And it's often the change, not the actual hormones themselves, but the change that induces changes in emotion. So, change in sleep patterns, change in eating patterns, change in mood, much like if a woman is experiencing premenstrual syndrome. It's not so much the hormone itself as the change in hormone levels that cause the change in those sorts of things. So it's the drop back to zero that can induce the mood changes, the sleep changes, and the body changes as well.
And I'm wondering, it's probably the same as all the other research that we've looked at. We don't actually have set times that we know that they're going to change, do we?
No. Plus, this is all going to be really complicated by the situational crisis that you have been through, the grieving process that you're going through. That's not all just hormonally driven. That's also very much psychosocially driven as well. And so it is really hard to tease out what is due to hormones and what is due to the fact that you've been through a significant situational crisis.
The other thing that we had a lot of questions about, and you might not feel comfortable even answering this, how should women negate the uncertainty or fear of trying again after a loss? Because there is it's a bit like the whole, if you have one fall, you're more likely to fear the next fall. And when we were talking to women, they were so nervous about miscarrying again. Do you have any advice around that? It's a big question, so it's fine if you don't feel comfortable answering it.
Oh, no, I feel comfortable answering it. I don't think negate it. I think that it's really important to embrace every emotion that you feel along this journey. And there will be many journeys in life that you take that will induce anxiety about uncertainty. Having a miscarriage is painful physically, it's painful mentally, it's painful emotionally. It's very exposing. You feel very vulnerable that you're in this situation that you can't fix, your partner can't fix. And you're often dealing with complete strangers in the emergency department, people who don't know you. And it can be quite uncomfortable and embarrassing that you're bleeding heavily and people are doing examinations, often in really sterile and unfriendly environments. So I can completely understand that there is huge anxiety about proceeding with another pregnancy because often we don't know why a miscarriage has occurred. We don't go and investigate miscarriage and reasons why often until someone has had 3 or more, because they can occur commonly. We don't necessarily invest a lot of time and effort in investigations if someone has had perhaps 1 miscarriage or even 2. So I would not negate the feelings. I would embrace them, accept them, talk about them, share them, but understand that this is a feeling that you will go through, but you will get through.
That kind of leads to the next question, because you've partly answered it, which was, what tests or investigations should I have or pursue if I've had 1 or multiple miscarriages?
Yeah. So a lot of the international guidelines talk about investigating when you've got recurrent miscarriage. And it depends whether you're using the European guidelines or the American guidelines as to which you will sort of take on board. But we do sort of talk about 3 or more. And really, if you're talking about 3 or more in a row, then that's less than 1% of the population, whereas one miscarriage on its own is probably about 1 in 4 to 1 in 5 females. I will often pursue investigations when I've got a couple sitting in front of me or a woman sitting in front of me, if they've had 2 or more, but it will often be dictated by the situation that they're in. So, for example, if a woman is 39 years of age, I may start to pursue investigations a lot earlier than someone who is, say, 30 years of age, because time is a little bit of the essence. Or I may start to pursue investigations if I have somebody sitting there with 2 pregnancy losses in a row and they have perhaps a bad family obstetric history, or if they're just so anxious and they're saying, I don't want to have another pregnancy until I have ruled out things that I can rule out. Similarly, I may have a woman sitting in front of me who's had 7 miscarriages, and she may say, do you know what, I'm okay with this, I'm just going to keep going for now. So it's often dictated by the situation in front of me, but generally my arbitrary is 3 or more in a row of pregnancy losses. I will certainly start to look at, are there any pathological reasons why this is happening?
Okay, the other thing is, if women are feeling that they're not being heard, and you've just said that you listen to women, what advice would you give them to try and get heard about this sort of stuff? Because some people felt that they weren't being able to get the information that they wanted because miscarriage was seen as such a common thing, but they really wanted questions answered. Do you have any advice on how they can phrase it or what they can do to get some more answers?
Yeah, so I guess a pregnancy loss is a physiological thing that happens, but it's not normal for a normal pregnancy to miscarry, if you know what I mean. So pregnancies don't miscarry for no reason at all. There is always a reason.
Yeah.
In 50% of cases, it's because the embryo itself was not normal. But there's an awful lot of cases that miscarry because perhaps the lining is not normal or something about the health of the woman is not normal. So a normal pregnancy doesn't miscarry for no reason at all. So I think that it's very reasonable for a woman to say, I'm not comfortable falling pregnant again until I have had some basic investigations done in case there is something that I can prevent from happening again. I think that's a really reasonable question because there are some very simple and quick investigations that can be done by a GP. You don't even have to see a fertility specialist. That can be done to reassure a woman that, hey, you don't have a problem with the number of chromosomes that you've got, or you don't have a problem with the number of chromosomes that your partner's got, and that's contributing to why they might be having pregnancy losses. Or an ultrasound could be done to ensure that she doesn't have an unusual shape to her uterus, which could be contributing to pregnancy loss. So there are some really simple things that a GP, but I think advocating for self and how much a pregnancy loss impacts on your decision to pursue another pregnancy, I think that's a really reasonable place to start, even if you've had one.
Great. And is there anything else that you think that women need to be aware of around after having a miscarriage from a fertility point of view?
I do think it's important to know your cycle. So what I often find with women who have had a miscarriage, well, I guess I see a lot of women who already understand their cycles because they've been trying to conceive. But there's an awful lot of women out there who maybe haven't been trying for very long to conceive, or perhaps weren't even trying at all to conceive, and they've experienced a miscarriage. So I think a very simple first step for a woman who might be in that situation would be to know your cycle. And there are lots of different ways that you can do that. There's lots of apps that you can access for free on your phone. There are tracking kits that you can get from the pharmacy that helps you track when you ovulate, or even just keeping a diary of the day of your first menstrual period, perhaps how long your menstrual bleed goes for and how long your cycle might be month on month, is a really good first step for a woman to take who's experienced a miscarriage.
Well, that's all really fantastic practical information, and I just want to thank you for being so concise and to the point with the information that you've given us. And it was just fantastic speaking to you, and it's made it even clearer for me on how we can help women, just how clear you were with your advice.
Pleasure.